G'day everyone, Dr. Nick Yim, GP, Harvey Bay.
And I'm Mark McMurtry, pharmacist in Harvey Bay. Welcome back to another episode of the Dispensary channel. We bring you weekly health professional updates, product reviews, and keeping your finger on the pulse. So Nick, what did we chat about last week?
Yeah, last week I thought we had a pretty interesting topic. We spoke about respiratory conditions due to the fact that we've got a fair bit of smoke in the air. So for those of you who missed that episode, have a look at the link below. Above, wherever it is.
Yeah, I'll put it somewhere.
And you can have a recap.
Very topical.
We also had a review of a local wine, a Cabernet Sauvignon from a Moffat winery, and we thought it was actually a 3.5 out of 5.
Bad.
So something that might be a stuffing filler for this year.
That's right, stuffing filler. Love it. So maybe this week I'll just have a quick chat about what we're going to talk about. This week we thought we might cover smoking cessation. We'll have a quick wine review and we'll do another quick finger on the pulse. And so let's get into it, hey?
Personally, I think, unfortunately, Australians, I think we do smoke a bit.
Yeah, well, there's a proportion of us. It's probably better than what it has been.
Oh, definitely. I think it has come down, and that's due to many reasons. I think greater education.
Yep, absolutely.
I think one of the big things that a lot of my patients tell me is the cost of cigarettes per pack. It's quite astronomical.
Oh, I think that's a good thing that that's come in, the tax.
Yeah. But in saying that, we do have a large cohort of our patients that are still struggling to quit smoking.
Yep.
So I'm sure now we know that you can get nicotine replacement in supermarkets, pharmacies. So often a point of contact would be the pharmacist, not the GP, especially for our younger patients.
Yep.
What do you often see, Mark?
Well, I just got to say right now that for any pharmacist watching, now is the time, it's the opportune moment to try and jump on people's New Year's resolutions, I think. I think it's great to see a lot of pharmacies promoting it and getting out there and having that chat, because it's a great icebreaker. If you can come out and say, hey, have you had a thought about anything for the new year? We're having a weekly topic on smoking cessation. So my thoughts are, now that I've said that, my thoughts are, I think it's not as used as often as it could be. I think a lot of pharmacists are still reluctant to actually get out there and break that ice, to have a chat with the patient. I suppose you don't want to make them feel bad, because I've had patients come in reeking of cigarettes, and I've said to them, hey, has anyone offered you advice about quitting smoking? And some of them feel offended by that. So if anyone's got a better way of approaching that, I tend to be as subtle as possible and use euphemisms. But I think at the end of the day, I think we could all try harder.
Yeah, definitely. I think I have the benefit of a private consulting room.
Yeah, absolutely.
So when I see my patients who are smoking, who are relatively healthy, inverted commas, I still encourage them to quit, because there are many health consequences of long-term smoking. Includes obviously lung cancer, lung disease such as your chronic obstructive pulmonary disease.
Yes.
You've got your esophageal cancer, heart disease, stroke, etc.
Yeah, beyond cancer, all sorts of, and then they don't realise that end stage, even nerve damage, loss of limb. My grandpa lost his leg, etc., etc.
Yeah. So I guess what I often do in my consult, I guess the first thing is assessing that person's motivation to quit. You're gonna get, I guess, more people buy-in wanting to quit if they actually want to quit. Okay, if you've got that patient that said, "No, I'm happy smoking 40 cigarettes a day," you're probably not going to gain anywhere saying each consult saying, "Oh, quit."
Yeah. That's right.
Anecdotally, what I do is at the start of the year, or whenever I do a health check, I say, just so you know, I know you're smoking. Have you ever thought about quitting smoking? And if they say, no, don't ask me again. And I said, that's fine, Mr. Smith. Won't ask you again. But as you're well aware, smoking is probably not the ideal thing for you to be doing, because you do have lung disease. How about we'll touch base again next year?
Yeah.
So that kind of breaks the ice a little bit, saying, yep, you're aware of it. And you've respected their wishes that you're not going to be harping on it every single time.
Yeah, well, I can imagine they'll get pretty sick of that pretty quickly. Yeah, and I've seen that happen before. Yeah, that's all. I mean, that's the trouble. You're right. In a pharmacy setting, we don't quite have the same privacy ability. once you have a better relationship with your customers, you will tend to lead into conversations that head that direction. But I'm interested to hear what your thoughts are now on some of the treatment options.
Yeah, definitely. I think the first thing, obviously, when I break down all health conditions, is breaking down into pharmacological and also non-pharmacological methods. So, smoking cessation is not different. Okay, so often people smoke for a reason. Okay, it could be stresses in their life, using it as a coping strategy. If they haven't addressed those background issues, the smoking cessation will be a lot tougher. Okay.
Yeah.
But I think the key thing is trying to incorporate their support network around them. So if they're in a family and hypothetically their wife smokes, their adult children also smokes, and neither of them want to quit smoking, it's going to be quite difficult for that particular individual to quit.
Yeah, I was just thinking, because I'm coming from a non-smoker perspective, but I do hear some of my customers say, look, that's their problem. Like after a few drinks, they might, have a sneaky cigarette. But having that support network there with a partner quitting as well makes all the world of difference.
Absolutely. And also, it's all about changing up their routine. So often people will say, the first thing I do is I get out of bed and I'll have a cigarette, then go to the toilet, and then have my coffee. So what I often say is okay, when you first get out of bed, why don't you do a 20-minute walk? Just to delay that first cigarette, okay? And that's even giving them some simple advice without even giving them a drug.
Yeah, I think, you know what, I find it's, again, coming from a non-smoker perspective, I think the trouble with and true addiction is their brain is craving it.
Yep.
And they're getting to that stage where it becomes a mind over matter. This is what I think. It's a mind over matter event, same as similar to weight loss. If you really want it to happen, you will make it happen, and you'll find what works for you. I don't think anything really is the same between all patients. So
it's definitely different person, different strategy.
Yeah.
But in saying all that, we do have pharmacological treatments available, and one of the most, I guess, widely known is the nicotine replacement therapy. So they come in many different forms.
So just breaking that nicotine cycle with the cravings, I think, is key. Or just simply replacing. Like if they want to pick up a cigarette, replacing that habit with putting something else, like, there's new devices and gum.
Definitely. So the nicotine gum, that's quite widely accessible from over the counter. Even the patches.
Little lozenges you can stick under the tongue. They're becoming more popular now because you don't have to chew on something for a long time. And then the little devices, if your true habit is actually having something in your fingers or putting to your mouth, then that little device can be a good replacement.
Absolutely. The other thing that I often use is similar to, say, chronic pain, is you might have, say, a nicotine patch as your baseline.
Yes.
And then if there are a bit of tough times throughout the day, you can actually use that nicotine gum as a slight breakthrough.
Correct.
Which is quite handy. A lot of people didn't realise that.
Yeah, they thought you could use one or the other. But I think at the end of the day, just communicating to your patient that there's no one shoe fits all, one size fits all. It's trial and error, and not to get disheartened. If they try one thing, a lot of the mentality is, just nothing works. It's just, well, let's try another direction.
And I think the great thing as well is from a cost perspective, nicotine patches are actually on the PBS.
Yeah, that's correct.
I think there are a few regulations on that, so part of the PBS guidelines, and I'm sure Mark will upload the criteria down below. But what they need to be in is enrolled in a support program, and one of the best support programs is actually Quitline. Okay. And one of the difficulties with the nicotine replacement patches, you can only get 12 weeks or 3 months in a calendar year, so a 12-month period. So that's right. A lot of doctors and maybe pharmacists aren't aware of that, so you can't just keep renewing the script.
No, they need to be aware that it's a concerted effort. Let's hit it now and try to get out of this habit as quick as possible.
Besides nicotine replacement therapy, I think we have a few other products that's available at our disposal, and I think that includes varicycline and bupropion. Do you see many scripts come through for those products at all, Mark?
Not as often as the nicotine replacement therapy. The problem right now is bupropion's unavailable. So even if you wanted to, you can't use it. Vareniclin's probably taken the lead as far as favourite.
Yep.
Hearing mixed reviews, I think it's important that the pharmacist really does have a chat with the patient about what to expect. There's no golden standard, no golden bullet at the moment for quitting smoking, but this is the closest we've got.
Yep. Like anecdotally, as a GP prescribing varenicline, brand name for that is Champix. It's still on patent. The great thing about this for the patient is that they can still continue smoking for that first 2-week window. When they up titrate it to the standard dose, and it can allow them to plan when their quit date is. And that's really important because in that 2-week window, I tell my patients, this is your opportunity to start developing your strategies of what are you going to do when you feel tempted to take a cigarette. Start jotting down where you've hidden your cigarettes, whether it be in the bathroom or in your back pocket, top pocket, where your ashtrays are, where if you have a special stool or seat where you smoke, it's just to get rid of those, I guess, reminders of smoking.
Yeah, that's it. It's interesting. I don't know if you hear this, but I get patients come back to me that have started their course of Champix, and they say, I get to day 3 or 4, and I quite physically can't put the cigarette to my mouth. It's just an internal, they just can't do it.
Yeah.
So I don't know if any other pharmacists have heard that, but it gets to a point where their brain just says, no, you can't do it. Yeah. And after that, a couple of months, they say they walk past other patients, other smokers, and they can smell them, and they go, oh, I can't believe I used to smell like that.
Yep, definitely. I think the other big side effect, just to be aware of, besides that nausea that you're describing, or that is also nightmares. A few of my patients do get, well, not really nightmares, I guess it's more the vivid dreams. They're a bit more real life.
Yeah, vivid dreams. I'm still, because I hear that with some nicotine replacement, so I'm still unsure whether it's directly related to the Champix or if it's because they've actually stopped nicotine abruptly and the brain's gone, oh, geez. Yep. I'm unsure whether I can put the finger on what's actually causing that. But you do hear, vivid dreams being a common side effect.
Yep. To be honest, bupropion, Zyban, because of the shortages, I haven't used much of that in
Did you prefer it over Champix? Or?
Not really. I think Champix or varenicline was a little bit easier to prescribe. And I think marketing has done they've done a good thing with the varenicline even for the patients, I think.
And they've got a great support network and system. So if they're not going through Quitline, Champix actually have their own website. It's on the packaging, so the customer has the ability to use that as their support network.
And I think those are the key things. Is no matter which pharmacological method that you try, it is ensuring your patient has that support network, and that support network, if you can keep it, I guess, quite wide, that includes maybe the GP, the pharmacist, the loved ones, and also Quitline. That's going to be quite handy. The other benefit about being on Quitline is that sometimes they even post patches and posts.
Oh, no kidding.
Yeah, so some of my patients have mentioned that, which is quite handy.
So do you, talking about that, support network, do you counsel your patients to chat with friends to bring them into the cycle? Because I've actually had patients that are so reluctant to tell people that they're quitting. It's almost that mentality of, well, if you tell someone it's happening, it won't happen.
Yep.
But I think that's probably not the greatest way to look at it.
Yeah, I think it's hard to say. It depends on that particular friendship group. But I think if they're true friends, I guess, if the analogy goes, that they'll be supportive.
Yeah, well, that's exactly right. That's
the key thing. All right. Anything else about smoking? Oh, I think the key thing, just to remind people about smoking, is that when people do quit, what you will notice is they will develop a cough straight away.
Oh, right.
Yeah, and that's often a good thing, is because all their villi and everything, all the their respiratory system is working again. So they will often come in complaining that they've got a new productive cough, and they feel well otherwise, but they're coughing a bit more for the first couple of weeks. And I tell them that's a good thing. Everything's working again. Yeah.
So how long do they usually expect that to last?
Oh, it's hard to say. Varies from person to person. Anecdotally, I'm finding it probably lasts maybe 2 to 3 weeks. But you examine them and they look good. They don't have any temperatures. It just means that you just kind of reassure them, say, hey, it's getting better. But for the GPs out there, just remember not to forget to do, say, a spirometry on them if the cough persists, because they might have an underlying chronic obstructive pulmonary disease due to their smoking.
Yeah, well, there you go. Good to know. Do I have any other tips for pharmacists? Not really. Just I suppose get out of your comfort zone. Really approach patients more and be open and willing to chat. And also just refresh yourself. Refresh yourself on the use of patches and the gums and things like that, because having that knowledge at hand really is helpful.
Yeah.
And letting your staff know how to approach it as well.
And the other key thing as well is that there's going to be a fair few other strategies that might not be evidence-based, is also rebutting those as health professionals to show which things do have evidence and which things don't.
Yeah, well, that's it. So you had a few that you had.
Yes, so just so you know, hypnotherapy on its own without appropriate counselling probably is ineffective.
So there's no evidence to support it.
Yeah.
I mean, look, at the end of the day, if a patient says, I'm going to try this, and this is their first thing, I'm not going to stop them.
Mm-hmm.
And if it works for them, all the better.
Yep.
But I think it's not something we should recommend as first line.
Yep.
Yeah.
Like, we've got great methods to recommend as first line.
Yes.
Things that don't have the evidence backing it, it's probably not a good idea that we are recommending it.
Yeah, well, that's exactly right.
Yeah.
Insurance doesn't cover that.
That's it.
Anything else that was not really great evidence behind it?
Yeah, they did comment on a few things, such as St. John's wort. So we know that
right.
St. John's wort is great for depression.
Yes.
For mild to moderate, but no evidence for smoking cessation. Interesting enough, it's a lot of these things might be handy for the underlying reason why they smoke, but not directly for the smoking cessation.
Yeah, well, that's a good point, isn't it? There you go.
All right, so let's move on to the next topic tonight.
Sure.
Obviously, if anyone else has any recommendations of what they do in their practice to assist with quitting smoking, please share your comments below. I'm always keen to get some of your tips and feedback.
Absolutely. If you've found something's worked really well in counselling, by all means share it. That's the whole point of these videos, is to get some knowledge spreading out there, and we can all learn from something. I mean, we're not perfect. I'd love to hear what you've got.
Yep. And moving on to the next topic, our wine review.
Let's do it.
Yep. You brought in quite an interesting drop today, Mark.
So this was a donation to me from a good friend of mine that's been watching these, and they said, let's give it a go.
Yep. So it's a Little Giant McLaren Vale Grenache, and it's got a beautiful wombat on as a label. 2018.
I'll put a photo up for you.
Yeah.
Grenache is not a style I've had much to do with.
No, it's actually not your typical Shiraz or Cabernet Sauvignon that we often renowned for in McLaren. Well,
there you go. Well, so we actually haven't tried this yet, unlike another episode where we already got into it. Geez. So as soon as we opened the bottle and poured it before to let it air, what hit me was just the aroma. It's deep plum. Oh, deep plum fruit. I'm gonna try this. I can't keep talking. I gotta try it. Oh, wow, that's so well balanced.
Yeah, it's a very, very. I guess I would say it's a pretty light to medium bodied red, and that's quite typical for Grenache. Usually, I see it blended in with the Shiraz. So when you see the Grenache blended in with the Shiraz, it actually lightens it up, makes it a little bit easier to drink, more palatable, and you don't have to wait for that wine to age. But that is very, very nice.
That's delicious. So for me, that sits in between a Shiraz and a Cab Sav. And it's got a really nice balance. This one in particular, you can tell it's got that dry tannin and that dry finish, but God, it's got a nice whole body to it.
I think this one here would actually be nice. Unfortunately, we're in Harvey Bay at the moment, and I think it's about 35 degrees.
Yeah, it's a stinker.
I think I would prefer this one a little bit more chilled.
Yeah.
Yeah. Probably if we chilled it, I think that would be quite nice.
Yeah. Well, they don't need to know that we're drinking hot wine.
So a bit of feedback there. I think that one there is a lovely wine. I'll probably give it maybe 3 out of 5.
3 out of 5. You're harsh today.
Yeah, 3 out of 5.
Maybe because it was hot.
Yeah.
Look, I'm going to give it a 4.
Okay.
I quite like that. So well balanced, plum, fruity notes, and just a slight dry finish.
Yeah.
4 out of 5.
And it's quite got a unique label, so you give it credit for that.
Yeah, that's the 1 point extra.
All right, so I'm moving on to Finger on the Pulse.
Finger on the pulse. What's out of stock? Actually, not much has changed since last week, Nick. I'll put up a little list, letting everyone know the changes if things are back in stock or what's freshly out of stock. No real changes. I did check the EpiPen Junior situation.
Okay.
They're expecting possibly to have it back next week, so about the 18th of December.
Okay.
So hopefully next episode we'll have an update on that.
Yeah, cool.
But I'll let you know in the on the screen. Besides that, nothing's really changed.
Yep, cool. I think one thing that we found a study recently as well for the EpiPens. Apparently, they're actually good for about 70 months after...
70.
So maybe you can put that link down the bottom as well.
So 70 months after expiry date.
Correct.
Yeah, there you go.
So if...
I mean, it's not... We can't really recommend people use it, but if you're stuck in a situation...
Exactly. Unfortunately, bupropion, the product that we're talking about tonight,
still unavailable.
Yep. That's a bit unfortunate.
Yeah.
But next episode, I think we're talking about weight loss.
Weight loss. That's also another fitting topic for New Year's resolutions. We're actually having a guest appearance.
Oh, right.
So you'll hear more about that next week.
Absolutely. All right. So if you want any more topics that you want us to have a talk about, or any wines that you want us to review, or any comments, please comment below.
Type below.
Don't forget to subscribe. I think I'm pointing in the right direction
That's right.
this time. Yeah.
I'll put it somewhere. I'll put it the opposite direction you point.
Yeah.
Subscribe and please let your friends know. I think it's great when I hear that people have watched episodes and their feedback. So let us know.
Yep. Excellent. Cheers, guys. Have a good night.
Till next week. Cheers.